Welcome everyone to the White House convening on the home and community-based long-term care investment in the American Rescue Plan. I cannot describe what an important down payment we are discussing today on President Biden and Vice President Harris's vision of a new era in the care economy, because we all know that when it comes to home and community-based long-term care, it is a win-win-win. It is clearly a win to provide quality care to the people we love the most at the times they need the most help. We know that it is a win when those care workers are treated, as I like to call, double dignity jobs, that they themselves are treated with the dignity of high pay, strong compensation, a career path, credentials, and the respect they deserve so that they have dignity as they provide dignity to so many other Americans. And third, it is a win for all of us and for the economy as a whole. We know tangibly, specifically, that when we have affordable, quality home and community-based care, it allows many family caregivers who would like to continue working to support their family or continue their career to do so, which contributes to their pursuit of potential, but also to our economic labor force and employment force participation, which is good for the economy as a whole. We know that when a skilled and caring direct service professional works with a young adult who might have autism or Down syndrome and helps them live as independently as possible or work as much as possible, they're not only contributing to that person's potential and sense of dignity, but to our economy as well. So we need to understand that this is the right thing for a society that believes in dignity, for a society that cares for its loved ones, but it's also the smart thing and in terms of return on investment and what is best for all of us in our economy at large. It is a win-win-win. What we're discussing today is that in the American Rescue Plan, the president passed and signed a provision that has ended up being the most significant down payment on the efforts to our vision of quality home and community-based care for all Americans. When the American Rescue Plan was passed, the provision that was there to support home and community-based care was estimated to be around $12 billion. What we're announcing today for the first time is that it has turned out that actually $37 billion is being used across the country in all 50 states to provide progress and establish best practices in home and community-based care. Now, it's no secret that there is political leadership in many of those 50 states that have been critical or opposed to the American Rescue Plan, and yet all 50 states applied, accessed these funds, and are putting them to good use, which shows that when it comes to home and community-based care for our loved ones, this is not blue state, red state, this is not Democrat or Republican, this is a family issue, it's a kitchen table issue, it's a universal, and proof to me and to many of us that there is overwhelming support not just for this important down payment, but for the long-term sustainable funding for home and community-based care that this president has fought for in this Build Back Better agenda and in his continuing budget proposals. It's also been extremely important because this program already has shown how much progress has been made. We just had a roundtable before our public session with many of the experts and groups around the country. And what has just been so impressive is how much all 50 states have stepped up and led the way. Now, when we talk about the best practices, it's not going to be just a think tank paper. It's going to be talking about Pennsylvania increasing the wages for 55,000 direct support professionals who work with individuals with intellectual and development disabilities. It will be talking about Colorado and Governor Polis increasing wages by over 25% for up to 60,000 home care workers. It will be about Maine and Governor Mill giving well-deserved $3,400 bonuses to 2,400 care workers, or North Carolina setting the model for ensuring that 80% of the funds that go to rate reimbursements go directly to workers, or Wisconsin, who is using the funds to recruit and direct 10,000 new workers that will have their credentials on the type of worker registry, or the respite care that 29 states have done. You will hear Secretary Becerra and Neera Tanden talk about things like this as our national goals for our country, but we will now have states that have already led the way, thanks to this important part of the American Rescue Plan. And I really, truly encourage anybody who is reporting or covering on the critical issue of home care workers, direct support professionals, home community-based care, to look at what has happened through the American Rescue Plan, look at the innovations that have happened, and realize that there is still a lot of the glass that's empty, but this has filled up a lot of the glass with best practices as well. We really have a tremendous panel, conference, which we will turn to. Today, we'll have Secretary Becerra, our Secretary of HHS, who's been our leader of this. Him and his team at CMS have done an extraordinary job. The fact that instead of $12 billion, we have $37 billion going to all 50 states is truly due to Secretary Becerra's leadership and his teams at CMS and their innovation. Next, we'll have our domestic policy advisor and our policy lead on home and community-based care in the White House, Neera Tanden. She and her team, Kristen Link-Young, Jessica Schubel, Rachel Patterson, are our permanent leads on these issues, policy leads in the White House, and led so much on our care executive order. We then meant to have a representative of the leadership of Congress. You know, there were so many members of Congress who played a key role. We really want to thank Congresswoman Debbie Dingell, who took a lead role in the House of Representatives. Of course, the chairwoman, Patty Murray, in the Senate. But we were hoping today, or planned today, to have Senator Bob Casey. I think there is no one who led as much on ensuring that the American Rescue Plan had this robust home and community-based care investment as Senator Bob Casey, and he has been a constant voice of advocacy for this and constantly pointing out the importance of all 50 states participating. Unfortunately, it looks like he may have a vote right now, which would keep him from speaking. If we can arrange otherwise, we will. But that is one obstacle in our agenda. After that, we'll have a panel that will include the SEIU Secretary Treasurer April Verrett, the National Domestic Alliance President, Ai-jen Poo. SEIU and National Domestic Worker Alliance have been great partners on this event and great leaders on this subject. And we'll also hear from a major national disability leader, Theo Brady, and two workers who will discuss from their perspective how they and other workers like them have benefited from this investment. And then we will finally close out with 3 separate interviews with governors who are implementing these policies. So you can hear directly from Colorado Governor Jared Polis. You can hear directly from Pennsylvania Governor Josh Shapiro, who I mentioned earlier was leading, particularly in the area of direct support professionals, and Maine Governor Janet Mills. We were very honored that last night the Vice President did the release of these numbers, and we thank her again for her leadership and participation in this announcement, but more importantly, in her overwhelming commitment to workers, to care workers, to union workers across our country. So with that, I really want to turn it over now to Secretary Becerra, because again, as the coordinator of the American Rescue Plan implementation, I think I know more than anyone. It is nice when Congress passes a bold, novel piece of legislation, but as the president would say, it's really all in the implementation. And while I coordinate all of the implementation for the American Rescue Plan, we are dependent on the leadership and skill and innovation of our cabinet members. And I think if you heard the conversation we had with advocates and leaders earlier, you would have heard nothing but praise for the leadership of Secretary Becerra and his team at CMS. So with that, I'll bring Secretary Becerra to the floor.
Well, first, good morning to everyone, and we want to say thank you to those who are participating today. I want to say an enormous thanks to Gene Sperling and his team, because Gene puts into action what President Joe Biden says must happen in America, and we are thrilled that President Biden has made this such an important part of his agenda. It is a priority for him. I want to say to Neera Tanden, who really directs the domestic policy that you see coming out of the White House in this administration, for all the work that she and her team have done. As the director of the Domestic Policy Council, she gives us the guidance we need in our departments to know where to go. And I want to say thank you to her and to her team for giving us this chance to be where we are today. But realistically, what I want to do more than anything else is thank some of the folks that you see on this panel, because they are so representative of the people that got us to this place today. I will tell you right now that my dad is saying thank you to each and every one of you. He passed on New Year's Day 2020, but he sees what you're doing and how it's going to help people like him, because he was the fortunate beneficiary of home care. He never had to spend any more days in the hospital than absolutely necessary. Every time he could either walk out or even be wheeled out of a hospital, that's where he wanted to be, going out of a hospital. And he said, I will not go back to a hospital if I'm now in hospice. And fortunately, his family was able to fulfill his wish. And so the 4 years that I lived in Sacramento with my wife, my dad and my mom moved in with us. And certainly the last year of his life, and of course the 6 months when he was in hospice, when he lived with us, we were his principal caregivers. And here's the deal. My wife and I could afford to do this. I was still working. I was the Attorney General for our great state of California at the time. And my wife is a physician. But we could still figure out ways with other family to make sure my parents, and especially my dad, had the care that they needed. Not everybody can do that. But there are people who are making sure that they care for our loved ones as if they're their own. And so to the workers who do that, my dad is saying to you right now, as I say, thank you so much for what you do, because you prove that in the American spirit, we think more than just about our immediate family. Now the thing is, we got to pay you back the right way. We can't just give you gratitude. We got to give you real money so you can survive when you get out there and start doing this great work, keeping families alive and flourishing at home instead of in some institution. And that's what this conference, that's what this American Rescue Plan initiative is all about. It is elevating those we care about most so they can spend their last years or maybe it's last decades, in comfort with those they love most, at home or in a community-based setting. And it's making sure the people that'll make that possible are rewarded, not just when they go to heaven, but while they're here on earth. And we want you to make more money than the folks that are flipping burgers in that hamburger joint down the street. But we know that we have to do better. And that's why it's so important that we do the work together. If I could give a shout out to April Verrett, who I know with all the angels from SEIU is doing tremendous work. To the folks who are today trying to organize to get to the point where SEIU has gotten, go. We want to help. And don't worry, April's going to have your back as you all try to get there. To Agent Pooh, who has a special place in my heart, and I know my dad's, because she figured out how to help immigrant families be part of this process, because so many of them don't know how to navigate this. So many of them depend on their family to give them the only care they can get. And so many of them are the workers who are showing the love and the care to so many people. Agent, to you and your team for everything you have done for so many. I know my dad is saying thank you. I know my dad is, and he's probably saying it in Spanish. Gracias. Gracias. I will tell you that to know that we have a president who is willing to dedicate dollars, because, you know, at the end of the day, you can have the best intentions, and spiritually you can be there with folks who need the care at home or in a community-based setting. But if you don't put it in your budgets, it's not part of your values. President Biden put his values in the forefront on home care. And he put not millions, but billions of dollars out there so we can make it real. That $37 billion that is right now going to work every state in the nation is just a down payment. Because the president has a budget, and I hope Congress is listening, that would provide another $100 billion to just have us grow this even more. And the best part about that is it's dedicated that money is dedicated not just to making sure we have the services out there, but it's dedicated to make sure it's quality services, because it's focused on giving people the pay they deserve, to make sure that some of those dollars are invested to increase wages, to provide benefits, to make it so that anyone out there in America say, I want to be a home caregiver. Because not only is it the right thing to do, but I can survive, and it will be the good thing to do for my pocketbook. We want that to be a place, a destination point in the career of any American. And we have to give people the respect and the dignity they deserve when they go out and work. There are angels in this room who have been doing this for some time. And there are angels up in heaven, like my dad, who are saying thank you for what they've done, and thank you, President Biden, for what you are doing. But we got work to do. And those angels better use some real muscle, because we need to get more of this done. We are looking forward to working with you. We set up a registry, so today it's easier for an American family to be able to locate that excellent caregiver without having to go through all the headaches and not know where to navigate. This registry will help so many people understand who is out there and qualified. And so there are so many good things that President Biden is letting us do, but at the end of the day, it'd go nowhere without the folks who provide the care. And so I just want to extend to all of you the thanks, not of the Secretary of Health and Human Services, but of the son of a father who got to live his last months with the people he loved most. That's what you do. That's what everyone should have an opportunity to have. And we're going to be right there with you to make sure it happens. Do not stop. We got your back. President Biden has said that. Thank you all for being here. Let me now present to you the person who makes sure the president's agenda domestically pushes the envelope on this, Neera Tanden.
Thank you. soon. Good morning, everyone. I really want to thank Secretary Becerra for those really phenomenal remarks. He's a great leader of the department, and really grateful for his leadership. And of course, want to say thank you to Gene Sperling for his leadership as well. President Biden and Vice President Harris came into office with the idea of making home care available and more accessible, and really putting that at the top of their agenda. And the reason why is very simple, because as the president believes, our work here is fundamentally about human dignity, about the dignity of people who need the best care and the dignity of workers who should demand respect in all ways. That's why we know that these are critical services for people to live independently in their communities in their last years and in need of service with that respect and dignity that every American should deserve. We know essential care work is and how those needs need to get done in ways that support care workers, especially family caregivers. The ARP funding was simply a down payment in strengthening home care services and improving the quality of caregiving jobs. Today's guidance from CMS on home care work registries will help further the president's commitment to home care. Work registries connect those who need care with those who can provide it, allowing enrollees to find the right caregiver for them. For example, these registries will show which languages a care provider speaks and their credentials, including whether they have been specially trained in providing dementia care or care to those with autism. The registries will also help care workers build their client base, learn about new training and other career advancement opportunities. We'll also connect with other care workers to exercise their collective bargaining rights, as well as facilitate access to healthcare coverage and other benefits. And I really want to thank the folks at CMS and HHS here who helped deliver these resources. The Home Care Work Registry guidance is an important and latest deliverable in the historic executive order on care. In the face of congressional inaction last April, the president signed this executive order, really historic opportunity, and that to provide a comprehensive set of executive actions, more than any president has ever done to advance care. In just 7 months, agencies have made substantial progress implementing that order. For example, the Department of Veterans Affairs launched a pilot program to provide mental health services to as many as 2,300 family caregivers and who care for our nation's heroes. In addition, the president's budget reaffirms his commitment, as Gene mentioned and others, reaffirms his commitment to this issue with $150 billion over the next decade to improve and expand Medicaid, home, and community-based services. As you know, the president put this at the heart of his Build Back Better agenda. It is part of the unfinished work we have in front of us, and it is vital to get the job done. We really want Congress to act in this arena, but we will continue to do everything we can to ensure that we are addressing the needs of workers and seniors, people with disabilities, and every single person who needs home and community-based care services. And with that, I will turn it back to Gene. Gene? Thanks. Thanks. Gene's gonna come out.
Thank you so much, Neera. We now want to get to really, some of the experts. I have to say, there's no issue that's more personal. And as I've learned about the worker registries, I have to just say, at a personal level, I only wish that had been around when I was caring for my mother and father over the last 7, 8, 9 years. It would have been an enormous, enormous help, and another win-win, because it would be so helpful for families like ourselves, but also what it does for the workers to know that when they're getting their credentials and skills that they will be able to let people know, and that it will help them with their career paths. So we now wanted to, again, talk with some experts and talk with some workers who can, tell us from their own experience. And really grateful to have the panel we have. April Verrett, this is not the first time that she's been on a panel for us in the American Rescue Plan. She also spoke in our workforce summit last summer. But she is the Secretary Treasurer of the small 2 million member Service Employees International Union. She has served as the president of SIU 2015, California's largest local union, where she fought on behalf of more than 400,000 long-term care providers working in both nursing homes and private homes throughout California. We also have Ai-jen Poo, who is the president of the National Domestic Workers Alliance. In 12 short years, with the help of more than 70 local affiliates and chapters over 200,000 members, the National Domestic Alliance has passed the Domestic Worker Bill of Rights in 10 states, the city of Seattle and Philadelphia, and brought over 2 million home care workers under minimum wage protection. And I just have to say, at a personal level, there's been no individual who has more informed me or kept this issue at the front of my radar than Ai-jen, and I really mean that, so thank you. We also have with us Angela Ingram from the great state of Pennsylvania, who's worked as a caregiver professionally since 2018. And before that, she spent 20 years as a job coach for those individuals with special needs in Western Pennsylvania, and as a family, is from a family of caregivers and a United Home Care Worker of Pennsylvania member as part of the SEIU. And then DeAndre Clark. DeAndre began working in home care in 2013. She has assisted in all activities of daily living to individuals who are aging, with disabilities, those suffering from dementia. And she joined the Domestic Workers Alliance and saw that they were helping to get higher wages, and she helped fight for that. She initially was earning as low as $7.25 while she was doing the duties of a certified nurse assistant. She, I think can talk a little bit about what she was able to do, work with the National Domestic Workers Alliance, and the work that Governor Cooper from North Carolina did to help raise wages there. And then finally, Theo Brady, who I've been happy to talk with just earlier today. Theo is the executive director of the National Council of Independent Living. He leads a cross-disability grassroots organization run for people with disabilities that represent Centers for Independent Living, statewide independent living councils. He has been the CEO of the center for 31 years. And he has, and one of the reasons that we, invited Theo is that we were working both with Senator Casey and with Governor Shapiro from Pennsylvania. And when we asked for recommendations, they both recommended Theo as somebody they look to for advice. So with that, let me go to April to kick it off. I mean, April, you and Mary Kay Henry, you've been, I guess I should say really it's been you guys and Ai-jen who really have brought a lot of these issues to me. Indeed, I can remember the meeting with Mary Kay over a decade ago when I was National Economic Council Director, and she was laying out her vision, which at the time, just 11 years ago, seemed visionary. Now we see so much happening. Tell us about what you've seen about the American Rescue's Plan down payment that has, helped support that once visionary but now real agenda.
Absolutely, and thank you so much, Jean, for making sure there is a space to give voice to the importance of of ARPA and particularly the funding for home and community-based services. I just want to start by acknowledging the 700,000 home care workers and the millions of other care providers in this country and our allies and our partners. Secretary Becerra talked about home care workers being angels, and they truly do have the heart of angels, but I also know they have the spirit of warriors. And care is essential is not just a nice platitude, it's become a battle cry for the millions of us who are standing on the front lines demanding that this down payment that has been made in home and community-based services is not just a down payment that we're so grateful for, but that it is a blueprint for what we know is needed to build the care infrastructure that this country deserves. The blueprint for further transformation that we need for the hundreds of thousands of workers and those that they care for who are still waiting for care. We can no longer be a country that does not invest in our people, that doesn't invest in those who provide the work of life-sustaining work of care. Because of the funding, $37 billion, which $26 billion of it went to the direct care workforce, states were able to confront the long-term care workforce crisis head on, one that did not start during the COVID pandemic, but one that came into the bright light of day. Like so many other crises, we were able to put a finger on and identify. And this administration stepped up to the plate and made the investment where it was necessary, but we're not done yet. We're going to take this down payment, we're going to take this blueprint and make sure we continue the investments that we need to care for our people. Thank you.
Thank you, April. Appreciate that. And let me turn now to Aijen. I know that you obviously have been pushing this entire agenda for many years, but I've also seen your more specific effort in states like North Carolina and other particular states. Tell us how this has worked and what the advocacy effort has been like in relations to these American Rescue Plan dollars.
Sure, absolutely. First of all, thank you so much, Jean, for your leadership and your commitment to home and community-based services. This is so essential. We have great champions, and you are among them, and we're so grateful. It's worth just saying that before the pandemic, the median annual income for a home care worker was $21,000 per year. So we were in a deep crisis where the people we were counting on to care for us could not care for themselves or their own families on the income that they earned. Then enter into the pandemic, and this workforce became our lifeline to some of the people who were at the greatest risk as a result of COVID-19, people with disabilities, older adults, and it became a matter of life and death. And this workforce showed up, and this American Rescue Plan also was the lifeline to our lifeline, became our lifeline to our lifeline. And what that has meant is that in all of these states where the funding has been adopted, it has not only been making crucial investments in protecting services for people who need them and the workforce, but it has given organizations like the Domestic Workers Alliance, SEIU, all of our partners in the aging and disability advocacy world, an unprecedented opportunity to raise wages and improve the quality of jobs for this workforce, which is at the foundation of our care economy. In states like North Carolina, we were able to leverage the American Rescue Plan dollars to raise the wages of home care workers $4 an hour to a minimum of $15 per hour. Huge. In New Mexico, we were able to leverage the American Rescue Plan dollars into a temporary wage enhancement that we are now trying to turn into a permanent wage increase so that the wages for home care workers are at 150% of the minimum wage someday very soon. And there are states, there's work like this happening in states all over this country, and it is not a day too soon because every single day, 10,000 people turn 65 in our country. By the year 2034, there will be more people over the age of 65 than under the age of 18. By the year 2050, there will be 27 million people who will need long-term care, and most of us are looking for it in the home and community. The American Rescue Plan, as you said, is the down payment that helps us build the workforce and the infrastructure we need to make these jobs good jobs for the 21st century that we can take pride in, just like we did for manufacturing in the 20s and 30s, to bring this workforce into the future and into the middle class once and for all.
Yeah, I mean, thank you. You know, the one thing I observed a lot coming into coordinating the American Rescue Plan was, one, these are all already the most valuable jobs with the highest value to people's lives without necessarily that value being represented in the pay. But you're right, the pandemic, I think, because people were taking some health risks, seemed to elevate it in a way that shouldn't have needed elevation, but did. The other thing we saw, which was an interesting dynamic, was that it was good to see some of the private sector wages go up for certain jobs. But one of the issues I saw constantly in the American Rescue Plan were people who were providing care found it much more meaningful in their lives to do so, but now faced higher wages in jobs that they didn't really want to go in. And I think we saw the danger of what happens when the pay for care workers doesn't keep up with the increase in other private sector jobs that may be good jobs, but may not add the same type of value. And so it's been an interesting challenge, and what you've been able to do during this time is critical. Let me now kind of go to ask Angela, having heard this discussion, how it looks from your perspective.
Thank you so much. Good afternoon. I want to thank President Biden first for inviting me to speak at this important event. My name is Angela Ingram, and I am a participant-directed home care worker from Pittsburgh, PA. I am also a proud member of my home care union, United Home Care Workers of Pennsylvania. I am here today with my participant, Mrs. Linda Stokes. I've been caring for Linda since 2021. I first became a caregiver at the age of 15 because my mother needed my help. Linda calls herself the comeback kid. She had 2 strokes, 2 hip replacements, and she's also a throat cancer survivor. Helping people is my God-given gift. You cannot do this work without feeling it in your heart. It requires unlimited, unconditional compassion, love for the work, patience, grace, and selflessness. Caregivers sustain lives. We are skilled professional healthcare workers, just like hospital workers and nursing home workers. The pandemic made it clear that we need to strengthen our care system. The American Rescue Act was a needed first step. ARPA was a lifeline for caregivers who had all but lost hope during COVID. Most of the funding was used to support the direct care workforce. It showed that the country was serious about improving this industry. In Pennsylvania, caregivers advocated and won an 8% rate increase and thousands of dollars in COVID bonuses. For me, this was an extra $1 an hour plus a $1,500 bonus. That meant a lot to me because I was able to catch up on some bills. ARPA also laid the groundwork for a registry of direct care workers. This registry would allow our participants to search for secure caregivers who best meet their needs. It is still a work in progress, but this service has the potential to save countless lives. Last year, a bridge collapsed in Pittsburgh. President Biden was there that day. Thank God no lives were lost, but I consider it a very important lesson about what happened with the fragile structure. Think of the bridge as caregivers and our participants. When you put too much pressure on us without repairs, improvements, or maintenance, we collapse. Right now, we are on the brink of collapse and our lives are definitely in danger. And I'm angry that some people act like though my life and Mrs. Linda's life and the lives of countless numbers of caregivers, participants are not important. Legislation like the American Rescue Plan is desperately needed to turn caregiving jobs into respected, desired careers to allow workers to care for themselves and their family members while caring for their participants. Additional funding must be secured and utilized to give participants more options to find and afford care. We need higher wages. We need more training. We need affordable health care, and we need time to be with our families. All workers need the opportunity to join a union and have direct role in the strengthening and stabilizing this system. It will allow and depend on support and engagement of elected officials at all levels, which is why I'm glad my governor, Governor Shapiro, is here today. There is much more work to be done, but I believe that we are moving in the right direction. And I will continue to dedicate my life to the lives of others. And I know that with continued conversation, we can work together and build a better care system for everyone.
Thank you. Thank you. And as President Biden says, this is the people's house. The White House is the people's house, and you and the hundreds of thousands of care workers like you could not be valued more. And now, and we just have to be able to have the action to back that up. Thank you so much. DeAndre, Ijan was talking about North Carolina and what happened there. Tell us from your perspective what's happened there and how it's impacted you and other care workers.
Hi, I'd first like to say thank you for having me and providing this space for me to talk and tell my story. I'm Deandra Clark. I'm a domestic worker, healthcare professional in Charlotte, North Carolina. I've been in home care since 2013. I started at $7.25 an hour. And I was working, and then in 2020, the pandemic hit. And it was like, okay, now y'all essential. Y'all heroes, you gotta go to work. It's a pandemic out here. I was like, oh my God. I had clients like, I need to get there for them because some of them didn't have families in the state. So I had to show up, and I did. And I became a hero. I was like, okay, but where's the increase in the pay? I don't get anything, and COVID is out here. I gotta go home to my family. I was scared, I was nervous, I didn't know what to expect. So I just knew I had to keep going there and show up at work, for my client, because they were, very much alone at that time. So I was there for them, I comforted them, I took the best care I could and treated them like they were my own. At the same time, I had to think about my family, like, man, I gotta go home, I'm gonna stay away from y'all because I've just been out here. It's a pandemic, it's something going on out here. So I continued to work. I went to my HR department. I said, well, can I get a raise? Y'all gonna give us some more money? They said, no. We had a ceiling at $10. After $10, you cannot work anymore. So now, the APRA came in effect, and other agencies was like, here's $20 an hour, come work with us. And I had to leave. Unfortunately, I gave them 2 weeks' notice. They still wouldn't try to up the wage or nothing like that. So I told my clients, I hated to leave them, but I got to go over here because they're paying me more money. You know what I'm saying? At the same time, I'm still trying to keep safe, washing hands, wearing masks. It was scary. It was a scary time at that time for a lot of us. Now I'm essential. I'm a hero. And I'm going, and it's like people were just quitting jobs in the healthcare field. Like, they was not trying to stay because the wages were still low. Then I was introduced to National Domestic Workers Alliance, and I found strength in an alliance that they had the same morals and values of us in fighting and advocating for a higher wage, better working conditions, more training, so that emboldened me to say, hey, I want to join this. So I got out there and I walked with them. I talked with them. I went to Raleigh and Durham, and we went a lot of places, and I'm so grateful that I did that, you know, and I'm going to continue the money that was given, much needed, but we need more. It's gonna run out in 2025. All 50 states said, okay, we're gonna take this, we're gonna help. Some did, some didn't. You know, shame on them. But the ones that did, we need more.
Right.
So I'm coming to my elected honorable officials today and say, invest in us triple times this time. Put the money up, because it's well worth it. You know, we had to make this considered as a good job for generations up under us to say, yeah, my grandma did this and she made good, you know. That's what we need. So that's why I'm here to tell my story.
All right. Well, thank you. I think the points you make are important. Very important. First of all, just as you're saying, how can you look and say that's positive for a state or the economy as a whole? For someone like yourself who's providing quality care to someone to have to leave to take care of your family. I mean, this is something President Biden talks about a lot. You shouldn't have to, there's choices you shouldn't have to make. You shouldn't have to make between, choice between caring for a family member and working for a job, and particularly having to choose between your family and another family who relies on you so much, and that is powerful. And we've said over and over again, the American Rescue Plan is a down payment. Now, what we heard today as we talked earlier with experts and advocates was that there are a lot of things happening that will continue for sure. The registries, many of the reforms will go on, but you are right, the commitment to increased pay has to be built in and established, and yes, indeed, likely requires additional funding, and that's why, as you heard Neera mention, we are still pushing for a 10-year solution, so there is no cliff. And truthfully, we know more is needed than that. And I think one of the reasons we do this today is not just to celebrate the progress, but to show all 50 states are using this, making progress. This is proof of concept. This is a down payment that's proof of concept for a longer investment. Theo, I'm going to let you kind of, wrap it up here a little. You're someone who's really, 30 years you've been leading. You deal with these challenges yourself personally, and yet at the same time, you have the ear of both the governor and senior senator from Pennsylvania. There's a lot of people who want to hear from you. So, give me your views on what you've heard here and what you're experiencing.
Thank you. What I want to do is share a little bit of my story.
Okay.
All right. I've been a person with a disability since age 15. I broke my neck playing high school football, and I've been a wheelchair user since then. And the pandemic did something. The pandemic, more than anything, demonstrated how essential home and community-based services are, how important they're needed. I have a little influence, as you indicated, and I have some connections. But even for me, it was extremely hard to find attendant care. And I actually had to start accepting unvaccinated attendants and put my life in danger because I wanted to get out of bed. So even now, we're still facing this crisis. Even living in DC, I had to move back to Pennsylvania because attendant care here was just so extreme. I was paying over $60,000 a year for attendant care services. So more home care agencies, many of them went out of business because they just could not find attendant care workers. We are still right now in this crisis. Don't let anyone tell you. And yes, I love it, the fact we got these monies, these $37 billion to do this, but so much more else need to be done, and I just want to talk about that. With home care services, with home community-based services, I can get out of bed. Without it, I can't work. With home and community-based services, I can contribute. Without it, I can't. Right? With home community-based services, I can stay with my family, I can live in the community. Without it, I am institutionalized, put in nursing homes where it had already been proven we often die. So please keep this in mind. I'm just one person with a disability, right? But I'm speaking for millions of people with disabilities whose voices this is not being heard, and I'm glad I'm here to speak on their behalf. It's important because, like me, this is happening in every state and every local community. We need to be aware of that, and we need to meet this challenge. I'll share with you this morning. We need to meet these challenges because it's about the decision makers. It's about the people who have the power and influence to make these type of decisions. And so we got to make home and community-based service a priority. There's no question that we need to invest in paying direct care workers better, and that improving pay and direct care workers is critical to making people like me and the millions of Americans whose voices I represent have access to the dignity of home-based services. That's why it's important that American Rescue Plan funds are going into hiring, retaining, and training direct care workers, and hopefully all the 50 states. That's what I'm hoping for. And why it's so important that the Governor Superior, Governor Paulus, and Governor Mills use these funds to increase pay, which is so important to providing more Americans with disabilities and more seniors with dignity that comes with access to home and community-based services. But the extent of this crisis and the extreme stakes for millions of Americans means that we got to do more, right? And I think that's what the challenge here today, to do more. Home and community-based services is the solution. There's no doubt in my mind that home and community-based services is the solution. This is a crisis that can be fixed. We're on our way to fixing it. More needs to be done. President Biden recognized this. He has made this a priority, and there's no one, like you just said, Gene, have worked harder than Senator Casey over the years. I have worked very closely with him, and I will continue to do that. I don't believe my life in this wheelchair came as a result of anything other than, working on behalf of other people. Lives depend on us making the right decisions. Invest in the home community-based services, and certainly you will get a return on your investment. I want to end with this. I've been working all my adult life, for 40-some years. I could have showed the path of being taken care of and staying on Social Security, and I could have showed that path. That's a charity model. There are so many people with disability who want to work and contribute, because the narrative is that we take more than we give, right? If we have home and community-based services, we can work, we can contribute, we can pay taxes, we can do all the things that people without disabilities take for granted. And that is what home and community-based services is all about. So keep being a champion.
Thank you so much. And, I'm fundamentally an economic advisor, and as I hear you talk, I just feel that those of us who do economic policy have not done a good enough job in making the case for this not just being the right thing and the moral thing, but the economic thing. And your life is a perfect example. As you said, without home community-based care, you can't go to work. You go to work, you're helping tens and hundreds of thousands of other people. You're paying taxes, and just duplicate that around. We've had a higher participation rate in the workforce of people with disabilities, in these last few years, due probably to the very tight labor market, but, it's not anywhere approaching something that our country can be proud of. So, thank you for making that case powerfully. Thank you for the fact that your life makes that case powerfully. So I want to really thank this panel. we're now going to move on to our next, which is a chance to actually talk to 3 governors who are implementing this plan, and very, very grateful to have all of them on the line. I really appreciate so much everything that's been said here. I now have the privilege of being able to speak to 3 of our governors. And these governors were not chosen randomly. They were not chosen because they just happened to be available. These are 3 governors that, when we talk to advocates and experts around the country, they were among the very, very top examples of people using this American Rescue Plan investment in home community-based care to set best practices, to increase wages, and we've seen this, everywhere. We have on the screen right now Governor Jared Polis from Colorado. We have Pennsylvania Governor Josh Shapiro, who was just hanging around with the president just yesterday, and Governor Janet Mills from Maine, who has been generous in participating in other American Rescue Plan announcements over this time. Governor Polis, I'm going to start with you. When we ask people about examples of where we should look, one of the things we heard was the degree that you work to use these funds to raise wages for direct care workers by over 25%. That you were using the funds to build a home-based care infrastructure that would last beyond even the specific dollars. Tell us how you've looked at this opportunity, what you're doing in Colorado to make sure that you are building that bridge to the future.
Thank you, Gene. Thanks for convening this panel, and thanks for elevating the voices of home care workers and home care recipients. It was great to hear the last panel. Really appreciate it. Reminds us who we're doing this work for and to help. It's great to see my fellow governors, Governor Mills and Governor Shapiro of Maine and Pennsylvania. For us, saving people money on healthcare has been a top priority since I took office 5 years ago. And in partnership with the Biden administration, we've been able to do a reinsurance program, saving people $411 million to purchase insurance in the exchange. We got a 1332 state innovation waiver, which was the first in the nation to combine the Colorado option with reinsurance, saving an additional $245 million in federal pass-through savings. We greatly appreciate the flexibility of Secretary Becerra. Of course, we've also been focused during this time on supporting the long-term care workforce, which is the subject of today's panel. That's a key part of making sure that Coloradans get the care they need. And that includes aging Coloradans with disabilities. In fact, 83% of individuals receiving Medicaid long-term services and support through Colorado Medicaid get their services in a home and community-based setting. So it's very, very important. And we have chosen to dedicate historic federal funding to support this work. The $550 million in ARPA funding is building on our already robust system in several ways that I'm going to get into: direct pay, supporting the workforce, increasing access, and innovation in the digital services to improve equity and outcomes. First and foremost in people's minds, of course, is workforce. And to fill critical jobs and retain workers, we've invested ARPA funds to raise wages for direct care workers to $15.75 an hour. That's the minimum now in Colorado. That's several dollars above our state minimum wage, and very important. And by doing that, we were able to, again, save money, reduce the need for overtime, help fill positions that were available. and make sure that people who provide home care can support themselves with dignity. We've also used federal funding to streamline training, providing zero-cost education for a number of different healthcare careers. So using the ARPA funds, the federal funds, we've made it essentially free through our community college system. As I like to say, it's a real free, meaning no textbook costs, no hidden fees, no shipping and handling. It's actually free to become a nurse assistant, an EMT, to get a number of the credentials that are very helpful for people in the home care space. And then also work to increase access to home care in rural Colorado and utilizing CNAs to support people that have physical and behavioral health diagnoses. We've utilized the implementation of Community First Choice to expand access to attending care services across the state. We designed a new wraparound program that includes housing support and community-based peer support for those who have a history of homelessness or lack housing security. We've utilized the Medicaid buy-in for working adults with disability and a supported employment pilot, which improved employment opportunities for people with disabilities. We supported transitions from institutional settings and innovation of residential settings. And Jean, you mentioned kind of the, people with disabilities working. One suggestion there on the federal side is more flexibility around phasing out rather than eliminating disability payments for those who are able to take on some work. For instance, there might be people who receive disability payments and of course some can't work, but there might be some that might be able, and right now I think they can roughly work maybe 12 hours a week, but there might be some that can work 20 hours a week, and finding some way where they're encouraged to do that, benefit from doing that would be wonderful. In the digital innovation space, we've broke down barriers to care through digital innovation, and that included grants to home and community-based providers that improved care coordination and increased access to e-health records. We also are engaging across the state through our workforce centers and other touch points around tech literacy to reduce the digital divide. Because of course, when we're talking about the elderly in particular, it's not just a matter of having the broadband and the access. There's a tech literacy piece, which is critical to help make sure they get the services they need. And we're also deeply committed to equity. We work with our tribes to expand behavioral health, the Ute, Mountain Ute, and the Southern Ute in our Native communities, helping families navigate the system. But without the historic federal funding from the Biden administration, Jean, I don't think we would have been able to reach the historic $15.75 per hour minimum for direct care workers that we worked on with the SEIU and were successfully able to implement, which has had so many benefits to our state, immediately in helping to fill the workforce and supporting a new generation of direct care workers, but of course for the recipients of those services as well, to make sure that the people are there to be able to provide for them. Really, frankly, in conclusion, Jean, the federal funding has really helped Colorado transform our Medicaid home and community-based services that 180,000 Coloradans rely on, and we know it's going to be even more, like the rest of the country, aging population. And that enables people with disabilities and those who are aging to continue to live where they choose, saving money, no matter what their age or diagnosis or level of care needs. And that's really a big goal, for that quality of life for people to remain in that home environment with the support they need. And we really appreciate the ARPA funds and the ability to work with the federal government to be able to provide more Coloradans that experience.
Thank you so much, Governor. Again, we saw that significant wage increase, I think affecting over 60,000 of your workers, if not more, and really appreciate what you've done and led the way on, and being willing to share it for not, for us here and also all the people watching. So thank you. I want to turn to Governor Shapiro from Pennsylvania. Now, you've had, you're doing pretty well on your constituents here. I have to say, Governor, you're so young. IGEN says more and more Americans are turning 65. So it's December 12th. And I turned 65 on December 24th in 12 days. So that kind of hit home with me. You've got a ways to go. But obviously Pennsylvania, has one of the largest investments, over $2 billion from the American Rescue Plan. Again, as a family, as part of a family that has a loved one with autism, I think any of those families really do get to know what direct support professional means, how important those are. I was really struck by how much you'd focused on increasing the wages for your state's 55,000 direct support professionals, among the other investments that you are making. And Pennsylvania's been good in using lots of the funds, innovative funds. We had previously bragged on you guys for giving 7,500 student debt relief to 7,000 Pennsylvania nurses. But tell us from your perspective, the areas you focused on and where you're seeing progress due to your efforts to implement this American Rescue Plan funding for home and community-based long-term care.
Sure. Well, Gene, thank you for having me, and thanks for the kind introduction. And most importantly, thanks to you for the incredible work you and your team are doing on behalf of the people of this country. I had the opportunity, as you mentioned earlier, to spend a good bit of yesterday with the president in what I affectionately refer to as his home state, the great Commonwealth of Pennsylvania. And I shared with him privately, and I'll share with all of you publicly, just how profoundly grateful we are for the various policies that you've put in place, the various bills that you've been able to get across the finish line, which I realize come with words like billions of dollars that oftentimes don't mean a lot to the average folks, but because of the president's determination, we've been able to turn those billions of dollars into real action for the good people of Pennsylvania and across this country. So, Gene, I want to thank you for helping shepherd that through the process, and just thank the president for his extraordinary work. Now, even though you're kind of the star of the show, you get the podium there. I must give a shout out to the two people who I think really are the star of the show, and that is Angela and Theo, who spoke earlier with their Pennsylvania ties. And you should note that Theo served on my transition team, and we've gotten off to a hell of a quick start with our GSD attitude, and Theo's a big part of that. So I want to thank you both, Angela and Theo, for your hard work and for being there. It's very cool that Gene has given you this platform to speak, and we're really grateful to you. Obviously, the American Rescue Plan was a huge win for the president, but it was a huge win for Pennsylvania. And based on the comments from my friend Governor Polis, and presumably you will hear the same thing from my good close friend Governor Mills in Maine, it made a huge difference across this country, and it's really changed lives. In Pennsylvania, we've got over 13,000 residents with intellectual disabilities or autism who are on wait lists for community-based services, 13,000, and nearly half of them, roughly half of them, are in what we refer to as emergency status. So they need services immediately within the next 6 months. And so we've put this money to good use. Gene mentioned before, we are set to receive about $2.6 billion between 2021 and 2025 from this new law. And that's going to help us really strengthen home and community-based care. And again, I want to stress, this isn't just some number. This is really a lifeline for so many people in the Commonwealth of Pennsylvania. So let me break it down in simple terms what it really means. We've been able to raise the industry average wage for 55,000 direct support professionals who work with folks with IDA, and that has made a big difference in their lives. We're able to train more home-based care nurses, including paying newly hired nurses to shadow experienced nurses, so they get that on-the-job training that we think is so important. We've been able to recruit and retain thousands of home care workers, from mental health professionals to paratransit drivers who take those patients to doctor's appointments. And we're working really hard, given all the workforce challenges we face in Pennsylvania, and I know my fellow governors are grappling with as well. We've been able to create a pipeline of new nurses by funding up to $7,500 in student debt relief for nearly 7,000 nurses who stay in the state for at least 3 years. I mean, gang, this is real stuff. This is making a real difference in people's lives. And I want to just give a shout out to another dear friend who's on the Zoom or will be on the Zoom, Mary Kay Henry of SEIU, and all of her sisters and brothers in SEIU who do really, really great work and have become partners with me in this effort. I want to just thank again the White House, because thanks to this funding, we're providing more targeted support for Pennsylvanians who rely on home care services, and we're helping people with disabilities, and we're allowing older adults to age with dignity in their own homes. We're improving pay and working conditions for our workforce. And I should note for the record that ahead of schedule, we just updated our Medicaid reimbursement rates for home and community-based services for people with autism and intellectual disabilities. So we're ahead of schedule so we could drive out more resources for those who are providing this care. And of course, we're working hard to build that pipeline of workers to address this important shortage. I have thanked Gene Sperling, I've thanked the President of the United States, and most importantly, thanked Theo and Angela. One person that I've not thanked yet, and I'd like to close with this, is Pennsylvania's senior senator, Bob Casey. Senator Casey has worked on these issues tirelessly over decades, and he routinely delivers for the good people of Pennsylvania. And I know it's not easy in that combative environment on Capitol Hill. Yet time and time again, Senator Casey figures out how to get it done for all of us. And thanks to his hard work, together with the president, they're making a real difference for Pennsylvania. So we're going to keep at it with our GSD attitude here in Pennsylvania. And for those of you who don't know what that means, I know this is a family program, so I'll just say it means getting stuff done. We are getting stuff done in Pennsylvania. And the reason why we're able to get so much stuff done is because of great partners like Senator Casey, like the President of the United States, like Gene and the team at the White House who care deeply about the Commonwealth, and like people like all of you assembled at the White House today. So I want to thank you very much for your hard work. And Gene, I'll turn the floor back to you and look forward to the comments of my colleague, Governor Mills.
Well, thank you. And of course, we all knew the S stood for stuff. There was no doubt about that. And, Senator Casey was supposed to be here and was the person who most suggested to me that we make sure we're highlighting what's happening. And the point that he always made to me was that when you looked even at the Affordable Care Act, there were political disagreements as actually kept some states over many years from participating, but yet on home and community-based care, Senator Casey's point was all 50 states, regardless of what their political leadership said about the American Rescue Plan, every single one applied for, utilizes the funds. He truly was the champion. There were others like Congresswoman Dingell and Senator Murray, but I think all of us would agree that he was the singular champion of this provision in the American Rescue Plan. And I thank you for everything you're doing. But also, I think one of the important things here is that you've created a best practice for the other 50 states and for going forward. And your efforts, particularly on direct support professionals, really stand out. So thank you very much, Governor. And I will now our last speaker will be Governor Janet Mills. When we were looking, in my job coordinating the American Rescue Plan, one of the things we saw in several elements, people often used with their state and local funds, was the importance of retention bonuses that would help keep people in their jobs, and I think in some ways also just show there was a value. And you're hearing, you've heard from Angela and DeAndre, that pressure. And we heard other governors talk about having to keep other frontline, but Governor, I think when I look around, I don't think there was a retention bonus as significant as what you implemented for care workers in Maine. It really stood out, and it was really one of the reasons why we really wanted you to have you speak on this panel. So, Governor, the floor is yours to describe how you've used these funds.
Thank you, Jean, and good afternoon, everybody. It was very interesting listening to Theo and Angela, and of course, my good friends, Jared Paulus and Josh Shapiro, with whom I'm delighted to serve. And, you know, in Maine as well, we've done investments in telehealth to keep people home and healthy, and we've done investments in credentialing and recruitment and bonuses, as you said, because we recognize that historically underpaid and underappreciated home and community-based home and community care professionals are responsible for providing the high quality care to some of our most vulnerable people here in the oldest state in the nation. They're taking care of older individuals, people with physical disabilities or intellectual and developmental disabilities, people with mental or behavioral health conditions, people recovering from medical procedures and or prolonged illnesses. I understand firsthand how rewarding and how important this work can be. My own parents had to have direct care as they aged in their homes and were comfortable being there with direct care, home and community-based professionals helping take care of them in their final years. I also know how difficult it can be without appropriate resources. My oldest son, or grandson rather, Zach, is a young adult with autism. His parents have had to, both of whom work, have had to make the transition between childhood services and adult services during the pandemic. That's not easy by any means. It wasn't easy for them. And I think about young Zach every time a Maine family tells me they're having a hard time finding care for their loved ones who need assistance. Already stretched thin before the pandemic, Maine's home and community-based workers have faced even greater challenges these last few years. One of our first priorities has been retention, retaining these workers and maintaining the critical care they provide to Maine families. President Biden's American Rescue Plan Act has provided a critical lifetime for us to do just that. My administration has used American Rescue Plan funds to provide well-deserved bonuses on average of $3,429 to each of more than 24,000 direct care workers across the state, every county of the state. And we did that for two reasons, obviously. First, to keep and reward the workers that we already have. And second, to recruit more skilled workers to that field. And that strategy has demonstrated some level of success. Last year alone, the agencies across Maine have said they hired at least 3,500, actually 3,574 new care workers, an increase in our state of 21%. Then we used American Rescue Plan funds to create a pilot program I think is interesting. We call it Respite for Me. That provides grants of up to $2,000 for respite care for families who care for a loved one at home. And through that program, the caregivers themselves can also get counseling and training, legal and financial guidance sometimes, and other services to maintain their own well-being, for instance, occupational physical therapy when needed. And we used American Rescue Plan funds to expand training programs at the community colleges to encourage young people, especially recent high school grads, to become healthcare professionals. That includes free tuition at our community colleges all over the state. We also created the Caring for Me campaign, which has social media advertising and in-person events and a new website where people can go to explore careers, to find job openings, and to read stories that highlight the importance of direct care and behavioral health care work in Maine, rewarding work. President Biden's American Rescue Plan came at a critical time for Maine. It allowed us to support our home and community-based care workers and to strengthen our healthcare workforce. I'm so proud of the progress we've made, but we're not out of the woods. As I mentioned, we're the oldest state in the country, trying to bring that down a bit. But despite an increase in the workforce that I mentioned, workforce of home and community-based care folks, we need more care workers. We are investing state funds where we can, but those funds are limited. And we very much want to keep people out of institutions, keep them comfortable in their homes, working and being productive whenever and however they can. And that is why I fully support the Biden-Harris administration's budget proposal for additional funding for home and community-based care workers. I strongly urge Congress to support it. These healthcare workers, some of whom you've heard from today, very moving, and the individuals whom they serve and who want to be productive members of society. This is all so important to the national economy and to Maine's economy. These individuals provide essential service and care to people in their communities, keeping people productive as possible and allowing family members to work as well, and allowing people to remain in their homes instead of more expensive healthcare facilities. Every day, families like mine rely on these people for care for loved ones. Congress could really help us by supporting the president's request and allowing us to continue to build on the good work already done by the president. Thank you, Jean, and I want to say thanks to Secretary Becerra, who's behind the scenes, for convening this call. The American Rescue Plan Act, under the Biden-Harris administration's leadership, has allowed Maine to sustain and strengthen our healthcare workforce, especially in the wake of the pandemic. If we are given the benefit of additional home and community-based care funding, I guarantee it will be put to good use to expand these services, increase pay, provide better work conditions for workers and benefits, help families and individuals stay employed, keep loved ones healthy, productive, and comfortable in their own homes. Maine's economy will surely benefit. Maine thanks you. My grandson, Zach, thanks you. And I thank you as well.
Well, thank you, Governor. I think you've established, with, again, a $3,429 bonus, but also the degree that you've substantially increased the minimum direct care worker wages to 125% of the state minimum wage. And it was interesting you mentioned the respite care, because actually 29 of the 50 states have chosen to use some of the funds there. And I think any of us who've been in that situation or have loved ones in that situation really understand much more than I would have just how crucial that is. I really appreciate really having all the governors this whole session. We've made clear from the start, this is a down payment, but we've also seen that down payment is actually leading to structural reform that will go on. And the fact that all 50 states are setting best practices and using it well really is proof of concept. It is actually not just a down payment to end, but actually, in some ways, should be government at its best, which is that you gave governors like this these resources. We saw the laboratory of democracy. We've seen people use it in different ways. This is what should give greater confidence to every member of Congress that in every state, red, blue, purple, this is critical, this is vital. People need the funds, every governor's using the funds, and now we know more what works and what doesn't work because of what's happened. So again, this is why we really believe this is important. Really want to encourage those who are writing on this issue, in the media or other places to look very seriously at the impact this has had and the degree that you can talk to advocates, care workers, governors across this country to see the difference it's made. And with that, relatively on time, we will let people go. If you are covering this and have questions in the media, you can feel free to reach us at press@who.eop.gov. Again, that's press@who.eop.gov. And with that, let me thank all our participants and panelists and governors. Thank you very much.